All right, so this is part one for chapter 15 in your pharmacy practice for technicians book. So, chapter 15 is professional performance, communications, and ethics. In this course, it is covering customer service and how important customer service is, especially when it relates to pharmacy technicians, especially in the retail setting. The goal of pharmacies is to have their customers to keep coming back. That's how they generate a profit. That's how you get paid, and that's how they run their business. From a hospital standpoint, our customers are a little bit different. Obviously, our customers will be the patients, but we're not seeing them face to face. The nursing staff is, so who in turn becomes our customers in a hospital setting? That is all of the hospital staff: doctors, nurses, respiratory therapists, physical therapists, OTA, which is occupational therapy, dietitians, everybody that we service or is working with our patients and could be ordering medications in some sort. So, knowledge of pharmacy practice. So, within your facility, wherever you go to work, you will be presented with a policy and procedure manual known as a P&P. Inside the P&P, it will outline the roles and responsibilities of all pharmacy staff members, so not just pharmacy technicians, but pharmacists as well. Any interns, which are pharmacy students, and then any other supporting role within the pharmacy. You should become familiar with the P&P and abide by all of its guidelines. Wherever you go, it could take up to a full 3 months for you to be fully trained and learn all the roles and responsibilities of your position within that facility or that company that you're working. Technicians may be trained to assume different roles in order to increase schedule flexibility. So that's true, especially in a hospital setting. They typically schedule pharmacy technicians for different areas or different stations. What they call that or how they do that is all different. It just depends on the facility that you're working at. But the more versatile you are, the more areas you're trained, they have an easier time making the schedule. It works out for emergency situations. So like with COVID, if they started having an influx of patients, they're going to need more staff. They're going to need extra staff in extra areas. It's just better to have more people trained in different, as many different areas as possible. You're going to maintain a professional appearance. So everywhere you work is going to have some sort of dress code. So that depends on where you work. So for example, at TMC, their pharmacy technicians wear black scrubs. So their whole hospital is color coded. Their phlebotomists wear red. The pharmacy staff, whether it's pharmacy technicians or pharmacists, it doesn't matter. The pharmacy department wears black. The nurses wear like a hunter green. The transport individuals wear blue. So it's just everybody has their own color coded. That way, when you spot someone in a particular color of scrubs, you know what department they're from. The hospital I worked in Albuquerque, I could wear whatever scrubs I wanted. So it just didn't really matter. If you're going to work in a retail setting, some places issue their own particular scrub tops or collared top shirts. Some of them require you to wear a lab coat. So it just depends on where you're working and what your dress code is going to be. Now, the important piece to that is that you are not just pulling your outfit for the day out of the bottom of a hamper. You want to make sure that it's clean, it's pressed. You want to be very presentable. You're also going to behave professionally, so that's following a standard of etiquette, remaining calm and effective during stressful work conditions. So especially right now with everything that's going on with COVID, as you guys transition out of your pharmacy program into your extern sites and then you begin to get hired, we're still going to be dealing with COVID. So a lot of places are going to have a higher stress level. So it's just being able to remain calm and effectively work and learn how to stress manage. Show up a little bit early to your shift. Okay, I say 10 to 15 minutes. That way it gives you enough time to get in, put your stuff in your locker or wherever you're storing your things, put your food in the refrigerator or wherever you're storing your lunch for the day. It just gives you enough time to make sure that you're there and ready to clock in. And as soon as you clock in, you're starting your workday immediately on time. The other thing is leave a few minutes earlier from your home. That way you're accounting for any potential accidents that have happened, any construction, anything like that. If you know you're going to miss work or you're going to be late, you always want to let your supervisor know as soon as possible. Many places have a 2-hour minimum, meaning you must call in or alert your supervisor 2 hours before your shift starts that you're not going to be there. Some places it's longer. You have more time that you need to alert them that you're not going to be there. The important thing is that you're being counted on. Yes, everybody gets sick. Yes, everybody has emergencies come up. But ideally is you really want to be at work every single day that you can and that you're scheduled. Maintain a positive attitude. That's especially important now than ever. This situation with COVID and having to teach online has not been easy. It's not been easy for me. It's not been easy for any of our instructors across our whole campuses all over the United States. We're an on-ground campus, and we're used to seeing our beautiful students every single day and being able to have that face-to-face interaction and being able to teach you in the ways that we want to face-to-face. And as hard as it is and as frustrating as it is, and I'm at home with 4 kids and 2 dogs and kids that are still in school, and it's been a huge transition, but I still maintain a positive attitude. I'm lucky and blessed that I still have a job. I'm still able to teach you guys, even if it is through online and videos, and knowing that this isn't going to last forever. It's going to be our new norm for a while, but it's not going to last forever. And just look for the positive in things. Take pride in your workplace. I'm extremely proud to work for Pima Medical Institute. I believe wholeheartedly in the mission. We do amazing things for our students. We have such a great body of students. And being able to be a part of your journey into your career path is something that I take a lot of pride in. When I worked in the hospital, taking pride in my job there, knowing that I was working every single day to save patients' lives. I was making their hospital stays a little bit better. I was preparing the medications that were getting them healthy and getting them sent home or saving their lives when these patients were coding. So it's just important overall to make sure that you're taking pride. If you don't feel that you have that pride or that you can have a positive attitude, then maybe the environment that you're in is not for you. So you want to make sure that you're using formal addressing of individuals. So what I mean by that is if you are working with a doctor, you're going to say Dr. Smith, unless you're told otherwise. I work with some doctors that are like, no, call me Charlie or whatever their name is. But until you get that approval or that okay from them, you're going to always refer to them in a formal addressing of them. That includes pharmacists. Some pharmacists prefer to be called doctor. Okay, I have not come across many of them at all. Most of them are very, very humble and they want you to call them by their first name. But there are some that I've come across that are like, no, it's Dr. So-and-so. So just make sure whatever their preference is that's how you're addressing your coworkers or individuals that you're coming in contact with. Your supervisors, you want to make sure not only your supervisors, but also your customers, you're using appropriate titles like Mr., Mrs., and Miss. And then their last name, sir, ma'am, how can I help you, ma'am? Thank you for waiting, sir. How can I help you? Professional restraint. So in response to customer queries about physicians. So this is important. If you have any experience with any physicians in Tucson or anywhere, and let's say you didn't have a very good experience with them, it's not taking away your experience with them, but legally, from a legal standpoint, you cannot provide opinions of these individuals. You can give them general information of, let's say a customer asks about podiatrists, and you're like, oh yeah, there's so-and-so, they're a podiatrist, this is what they do, this is where they're located. You cannot be like, well, I went to that doctor and he's terrible, he screwed up my leg, or whatever the case may be. You can't do those things. They can actually sue you for that. You can get a lawsuit for slander, and don't put it past these physicians to do that. Managing change. Again, you're managing change right now. Not necessarily in a workplace. Maybe some of you are. If you're still working, your workplace probably has changed in some sort of fashion with COVID-19, whether you were at stay-at-home orders first, your facility closed, wherever you were working closed. Maybe you went down to a skeleton crew. If you worked in a restaurant, you went to dine it or take out only. So it's just managing the stress. It is not easy. Okay, no matter where you go, what you're doing, and especially for all of us right now in the world, this is not an easy situation. This has taken all of us by surprise. I don't think any of us really thought that, by the end of March, beginning of April, we would all be sitting kind of where we're sitting at right now with stay-at-home orders and all these social distancing guidelines. But the same thing goes for working in your pharmacy setting. You want to try to make sure that you're managing the change well. Change can be from management. One supervisor's left, a new one's coming on board. Work or vacation schedules. You cannot anticipate coming out of the pharmacy program and getting a Monday through Friday 8 to 5 job. That's just very unheard of for the most part for the pharmacy world. If you're going to work in a hospital, they're open 24 hours a day, 365 days a year. That includes holidays. Be expecting to work weekends. Be expecting to work nights. Be expecting to work holidays. That's the profession that you chose. We do a service to patients, and most facilities, they don't close. Some have odd hours. Fry's, Walgreens is open till 9-10 o'clock at night. There's a couple locations for Walgreens that are open 24 hours a day. So just take those things into consideration. Managing your policies and procedures. All of the time, policies and procedures are going to be changing. Something as simple as there was a medication error that occurred and harmed a patient. Whether it harmed a patient or not, they're going to take a look at the way that policies and procedures are handled. I apologize for my dogs. There's going to be a way that they're going to look at policies and procedures and see if anything needs to be changed. Where was the breakdown? Where did the event occur? How did the error occur? So be aware of that. Insurance plan coverage. Okay, some retail pharmacies accept some insurance. Most insurance in some places don't accept particular insurances. That's all a contract base. So over the years, and as time goes on, you could be accepting one type of insurance for 3, 4, 5 years, and then all of a sudden not accept it anymore. Drug dosages and formulations, so managing the change of that. If you're used to working with one particular drug in one strength, you can't always be dependent on that. You have to understand that these things can change all the time. New software and equipment is exactly the same thing. Pharmacy software will update as frequently as every year or every couple years, depending on what the pharmacy software is or what the equipment is. And again, it's evolving. It's evolving to keep up with the technological advances in healthcare. It's evolving to keep up with all of the laws and regulations that are being brought forth. And it's also evolving to ensure our patient safety. So you just want to manage, especially the change constructively, and always be a team player. Don't just look at your job as, this is my job, I was scheduled this, that's it, I'm going to do my job and not help anybody else. That's not going to work. That's not going to fly in a pharmacy setting. You're a team. You need to work together. Yes, you are going to have your responsibilities that you need to finish and that you need to do, but if you finish those ahead of time, you should be helping out your teammates. So again, teamwork is part of that is also respecting differences. So we all come from different walks of life, right? You need to be respectful of the differences between employees, and your differences should not interfere with the work at hand. It doesn't matter if you don't like Billy Bob. you still have to work with them. Okay, you're entitled to your opinions. You're entitled to like who you like and who you don't like. But if you're working together, you have to maintain that level of professionalism, get along, be respectful, work together as a team. If you happen to have any unresolved issues or situations that have arisen, you want to make sure that you bring that to the supervising pharmacist or whoever your supervisor is privately. Do not create a high school environment where the gossip is just going around. That's not going to end well for anybody, including you if you are right or wrong in the situation. You want to make sure that all of that is handled privately with the supervisor, between you and the supervisor and whomever you're having the issue with. Any criticism of an individual's quality of work should be done so in constructive learning experience, not saying, what are you doing? That's terrible. You can't do it like that. You stink. Okay, that's not how that's going to go. You're going to say, hey, Charlie, how you doing? I noticed you were doing this way. Can I show you an easier way? Or this is why we do this because, all right? You want to handle it in a very constructive manner where the individual is learning and not feeling attacked. So teamwork is also appreciating the contributions of your colleagues. So this involves building a rapport amongst your colleagues, recognizing the contributions with common courtesy, whether you like them or not, and showing an interest in you. Another way you can build rapport is showing interest in your coworkers' personal lives. Now, not everybody is as open and willing to share their personal lives. And that's okay. And maybe you're one of those individuals as well. That's okay. There's nothing wrong with that. But, as time goes on, we spend more time with our coworkers than we do with our own family, except for some of us right now. In that situation, you need to be able to find a way to get along. You need to be able to find a way to meet on common ground. And some of you are going to build some very good, long-lasting friendships from these. So there's two types of communication, and that's where we're going to stop here after we review this slide. So slide 12. Excuse me. So verbal communication. So you have verbal and nonverbal. Okay. So your verbal communication will consist of facing your patient and speaking slowly, avoiding slang expressions. Being a good listener, summarizing and repeating any requests, because that shows that you're actually actively listening to what their needs are, and then asking open-ended questions. So if you're not quite sure exactly what it is the patient is asking for, or what their problem is, or what the situation is, asking open-ended questions can help you kind of get there. Your nonverbal communication is being aware of your facial expressions. I have a very hard time with this. I wear my emotions on my face. You can tell if I'm happy, you can tell if I'm irritated, and a lot of times I have to stop and physically think to myself, oh gosh, what does my face look like? Because I can show that, and that's something that I've had to really wrangle in over time. That's just something that's been part of me since I was born, I'm sure, and you'll see that and you'll get to know that when we're finally face to face, and probably on some of my videos as well. But you want to do your best to be very aware of what your facial expressions are. Making sure that you're making eye contact. If there's an individual who is talking to you, the worst thing you can do is not make eye contact with them. If you're not making eye contact with them, they do not believe that you're engaged, that you're listening to them, or that you have any care in the world about what their issue is, or in any way of wanting to help them. Carry and hold yourself with good posture. If you're just slouching around, right, that could put off the wrong impression to people that you don't care about your job, or maybe you're lazy, and those aren't the cases. So just be very aware of that. And then also use a pleasant tone. You don't want to sound like you're screaming and yelling at individuals, but you also don't want to talk too low where people can't hear and understand what you're saying. So that's slide 12. You're going to review the PowerPoint up to slide 12 and go ahead and complete the daily assignments. If you have any questions, please don't hesitate to give me a call. You have my phone number. You can text me. You can email me. And until then, have a good day.